Hi everybody, I'm Dr. Cole of the Cole Health Institute, and I thank you for your interest in our upcoming thyroid weight loss workshop. With summer having come to an end, I'm sure that a lot of you are still dealing with the same weight issues. My guess is also that your frustration level might be at the point that you're ready to throw in the towel because diet and exercise are not working. One thing that we know is that you can reach a point where weight loss becomes impossible no matter what you try. And to make matters worse, some of you are dealing with a long list of symptoms, maybe fatigue that's altering the quality of your life, brain fog, depression, mood swings, your sleep is not what it should be, or you just maybe are feeling stressed out every day. Well, this is the reason why we have the workshops, is because in my 30 years, I've seen these type of conditions reach near epidemic numbers. And usually it's related to the thyroid in some form or fashion. At the workshop, we're going to be discussing the cause of these conditions. Because frankly, if you're not dealing with the cause, you have virtually no chance of affecting a cure. One thing I want you to understand is this. You don't get a disease on Monday when Sunday your body was perfectly healthy. Disease is the end result of years of dysfunction in the body, potentially years of dysfunction in the body that may culminate in something that we can put a name to, like a disease. So finding out the cause of that dysfunction is going to give you the possibility of affecting a cure. But like a headache that is not caused because your body lacks aspirin, thyroid conditions are never caused because your body is lacking thyroid medication. Medications treat symptoms at best, and when it comes to the thyroid, oftentimes they don't do a very good job of that. So that's the frustration that we see. There's two types of patients. There's a type of patient that is on medication. They've been diagnosed with maybe hypothyroidism. They're on medications, but they can't lose weight. They feel bad, they feel poorly. And then there's a second type of patient that's even more frustrated because they've gone to the doctor. The doctor has told them that their TSH levels are normal, so they don't have a thyroid condition, yet they can't lose weight. They feel poorly, even just as poorly as the people that have been diagnosed. So, at the workshop, we're going to discuss the reasons why people get sick and then how you can get well. And if I can use some examples to kind of bring this home a little bit. Going back to the testing as it relates to the TSH, there's not a single medical study that shows that having a normal TSH level implies that your thyroid is healthy, yet that's the test that they use to determine that. And if you go a step further into the literature, you'll find out that the people who do have thyroid conditions, the medical literature states that over 80% of them have an underlying autoimmune disorder that is literally destroying the thyroid. Yet it's almost never tested for. And the truth is this, that if you have an underlying autoimmune disorder, that has to be dealt with if you're ever going to get well. And the big problem is that if you don't deal with that, it doesn't only affect the thyroid, it can also start to affect other tissues in your body, creating other disease type situations. The third example I'd like to give you is something called reverse T3 dominance. We see this in a lot of people that test normal. And what this condition is all about is that under stress, if the person is under enough stress, that their body's ability to utilize the hormones that are available is going to be negatively impacted. So you can test normal as far as that TSH level is concerned, but your body is unable to utilize those hormones. They're unable to get into the cells and do their work. And that can explain how people can feel the way that they feel, yet test normally. And then the fourth example I'd like to give you, and this is something we talk about, is the standard American diet. It's at the heart of a lot of these type of conditions that we see in our society today. But the thing is that when a person reaches a certain state, even so-called healthy diets can have parts to them that help exacerbate the underlying condition. So if you're frustrated, there's that word again, if you're frustrated and you're looking for answers, you're looking for solutions, I really would encourage you to come to the workshop. We're going to be able to provide that for most of you. We're not going to twist your arm. We're not going to try to sell you on anything. My job is to give you the information and then have you decide whether or not it makes sense to you. The rest of it is up to you. And along those lines, if you have anybody that you feel is suffering from the same type of situation, your ticket will allow you to bring 2 extra people to the workshop at no additional charge, and as a show of appreciation for doing that for us, we will give you a gift that is valued at $30. One thing I forgot to mention to you is that if we go back to what I was discussing in terms of the autoimmune disorders that underlie these conditions and that reverse T3 disorder that I discussed, we have 2 very simple tests that we can do to determine whether or not this is your situation and whether or not, as a result, you can be helped. So we look forward to seeing you at the seminar, at the workshop. God bless.